Good. Let us look at GIT pharmacology, and we are going to focus on antacid to be, as you know, that our stomach produces a lot of hydrochloric acid, which is bad for making ulcers, gastritis, duodenitis, and also esophagitis of the lower GIT, resulting to inflammation process, which at the end of the day sometimes may be affected also by H. Helicobacter pylori, which is a very good bacteria which drives where there is a hydrochloric acid and can cause, can predispose somebody to cancer of the stomach. So today our topic is about antacid, and antacid are what we call base or salt which neutralizes stomach acid, the hydrochloric acid in the stomach. So there are various types of acid. For example, the most common one is calcium carbonate, sodium hydrocarbonate, aluminum hydroxide, and magnesium hydroxide, and magnesium oxide, and magnesium hydroxide, which is combined, and this one is called the milk of magnesia. Also, we have the reactions. How do these, you give a patient various bases or various antacids, and then let us see each type of variety of drug. How does it react with the hydrochloric acid, and what is the final product of this hydrochloric acid? Depending on the molecule you are giving, because there are so many salts in the name of antacids in the market. So, for example, if you give a patient a calcium carbonate based type of antacid, it is going to react with the two molecules of hydrochloric acid in the stomach, and the result is calcium chloride, and also water, and also carbon dioxide. Then when you give sodium hydrocarbonate, then you give sodium hydrocarbonate. When you give sodium hydrocarbonate, it reacts with the hydrochloric acid and then to salt, which is sodium chloride plus water plus carbon dioxide. So you can see that these two molecules, both of them, they are going to produce a carbon dioxide in the stomach, and this carbon dioxide again in the stomach is expelled out. The patient comes some air out, and that is the side effect of this type of antacid. Then there is another one which is called aluminum hydroxide, which one react with them 3 molecules of hydrochloric acid resulting to aluminum chloride plus water. Then there is another one which is called magnesium hydroxide, which reacts with 2 molecules of hydrochloric acid resulting magnesium chloride plus water. And then there's magnesium oxide plus hydrochloric acid to magnesium chloride plus water. So that is how these antacids work. Their purpose is to neutralize reactions, and they act as a buffer in the gastric stomach, which results to reducing the acidity in the stomach, resulting to reduction in the stomach. Acidity in the stomach. So when gastric hydrochloric acid reaches the nerves in the gastrointestinal mucosa, and you know that the gastric mucosa is innervated by vagus nerve. The signals go to the central nervous system. This result is to exposure and result to pain. The pain. So what causes excessive release of stomach acid is alcohol consumption, eating certain type of food like citrus product, pilipili, smoking, certain drugs like steroid anti-inflammatory drugs like aspirin, stress, are causes of excessive acid in the stomach. Then these antacids are available in various forms. There are some of them are in capsules, others in tablet, others in powder form, others in chia, others are sensible tablets. So depending on your patient, what do you exactly want to achieve, and what is the need of this patient? Is this patient able to take a powder? Is it patient to take suspension? Is it able to take tablets, or what is need? So the prescription on the type of drug you're going to give purely depends on what you want to achieve and the need of your patient at a personal level. So some famous antacids brands in the market is like a Kaiser Tenza, which is contains sodium carbonate, and also potassium hydrocarbonate. And also you have equator, which contains aluminum hydroxide, and plus also it contains magnesium. Then you have gavlation, which contains aluminum hydrochloride, marox, which contains aluminum plus magnesium and hydroxide. We have marox with tablet, which contains calcium carbonate. We have milk of magnesia, contains magnesium, peptone, which contains hydrochloric carbonate. Then we have calcium carbonate for children, pepto-bismol. We have rotin, which contains calcium carbonate, magnesium hydroxide. We have calcium carbonate, and also myranthine. So drugs name, you have drugs like which in this one is aluminum hydroxide, magnesium hydroxide, calcium carbonate, sodium bicarbonate, and bismuth, sabrin, silica, and histamine. And acetylcholine is a type of anti-inflammatory, or rather it causes inflammation. Histamine, the histamine causes inflammation, and also it in the gastric, so that it prevents acid production. So we have some important commonly used antacids is aluminum hydroxide, magnesium hydrochloride, and calcium carbonate. We have sodium bicarbonate and sodium bismuth are the most commonly used type of antacid in our setup. So I think we used to bring down the gas lining in the stomach because they provoke production of histamine, which produces a lot of mucus, so that there is a wetness around the lining of the GIT, but it is not affected by the chloric acid. It prevents heartburns, it prevents ulcers and the lining of the GIT, especially the stomach walls. Because of high acid in the stomach. So what are the side effects of these antacids? These antacids can, like magnesium compounds, can cause diarrhea. Aluminum compounds can cause constipation, and also can interfere with the absorption of phosphate in the formation of bones. They can interfere with the bones, and especially if they are taken for a long period of time. Then the carbonate may generate carbon dioxide, leading to bloating and what? And the flatulence. Then calcium containing molecules may increase calcium output in the kidney, resulting to kidney stones. Then sodium related, they can cause water retention, resulting to hypertension and heart failure, and also renal diseases. So who cannot take antacids? Patients with kidney failure or heart diseases. Sodium bicarbonate has high sodium content, so you have to be very careful because this patient will have a problem of water retention, resulting to what? Resulting to high blood pressure and the kidney problem. Pregnant mothers, in pregnant, if a lady is pregnant, antacid are safest for heartburns and also symptoms, but not used in antacid. So we take antacid when you have heartburn, to treat the symptoms of the GIT, like upsets, and then also the utility combination of antacids is not clear, although the combination of magnesium and aluminum salt may prevent alteration of the viral habits. So typically feeling restlessness, intention, and feeling nausea and vomiting sometimes can be given this antacid. And that is the end of today's topic about antacids. They are very important to put with practice, and they are even sold over the counter these type of drug. Patients prescribe them some themselves. So it is very important for you to understand that one. So thank you very much for the listening.